Dr. P here talking about the hypoglossal nerve. As you saw in the last vignette, this nerve will penetrate the lateral mass of the occipital bone as the hypoglossal canal. To see the canal, you have to go down and a little bit lateral, which we'll do in a minute. There's the hypoglossal nerve, but I want to clarify one thing. There's a little bump right here, which is actually the pyramidal bump. And behind that, if we scroll a little bit up and down, you can see a second little bump. There's your second little bump, the olive. So this is going to be a pre-olivary position of the hypoglossal nerve, whereas 9 and 10 are going to have more of a post-olivary, more posterior position, as you saw on earlier vignettes. Then as we scroll down, we lose the nerve for a little bit, kind of gets buried and hidden by the pulsation phenomena and anatomy of the vertebral artery, but there is our hypoglossal canal with an anterolateral course. We said there are multiple rootlets that converge into one nerve, sometimes two nerves traveling together, but no more than two trunks is what you see with the hypoglossal nerve. Now, the hypoglossal nerve passes through the subarachnoid space. It passes the dura mater in the hypoglossal canal and in the opening of the occipital bone as we described. But after emerging, it gives off a meningeal branch. It picks up a branch from the anterior ramus of C1, and you can start to see those branches as we scroll downward right here. Here are some of the branches down lower of the upper cervical region, C1, and then it travels close to the vagus nerve and spinal division of the accessory nerve, spiraling downward behind the vagus nerve and passes between the internal carotid artery and the internal jugular vein lying on the carotid sheath. So it's going to sit as you would expect, because 12 comes after 10 and 11. It's going to sit behind the vagus nerve as it descends. Dr. P, out.